Hi, I'm Dr. Melissa Lopez at Shadelands Pediatric Dentistry. Welcome to our webinar series. Today we will be talking about the Myo Munchee. Let me share my screen here. Here at our office, we started using the Myo Munchee about a year ago after doing research and learning about it with our patients. And we've had really great success. But what we've found is that in discussing how it works, why it works, and how to use it, we sometimes run out of time. So what has helped us with some of our other programs here at the office has been to record a video and post it on our website and our YouTube channel so that parents can, at their own leisure, I know a lot of parents don't have a lot of leisure time, but maybe once the kids are in bed or God forbid, when you get some time alone in the bathroom, you can watch something short that explains it a lot better so you don't have to remember everything when you're here in the office. So with that, let's get started. Again, my name is Dr. Melissa. We're going to go through the Myo Munchee today, some opening remarks, the history of the Munchee, what the Munchee is today, how does it help, and what our program looks like here in the office. And with that, I'm going to turn this over to our lovely pediatric dental hygienist, Denise Meza. And here she comes.
All right. Hi, everyone. Good to see everyone here. So, opening remarks. My name is Denise. I am the clinical coordinator here at Shadelands Pediatric Dentistry and the Myo Munchee program director. So, all of this airway health stuff goes down to our why. So, it's to identify potential issues early enough so our patients can help growing healthy smiles and minds for healthy breathing and sleep into adulthood. So, this is why we do all of this airway focus education stuff and all of the time that we've been taking to make these videos. So here are some common questions from parents that we've heard over the year of introducing the Munchee, and we'll be addressing these questions during today's presentation. So the Munchee, the history of the Munchee. So it was first created and developed by Australian dentist Dr. Kevin Burke. He first patented the first Munchee and named it the Chewer in 1966. So he actually created it in order to help some of his patients with periodontal disease to improve their health. It has prongs, as you can see here in this picture, that helps stimulate the gum and help with gum inflammation and actually cleaning the teeth. It also helps with the development of the bone. So in 1975 and between 1975 and 1979, there was a clinical trial by Japanese researchers at Osaka University. And when they used the Munchee on children, they saw a lot of positive results. So some of them were improved oral hygiene, positive change in bone growth, changes in facial shape, changes in occlusion, and in children 3 to 6 years old, they all improve muscle strength of the orbicularis oris, which is your lip muscles. So these are a lot of changes just from one device. So these results actually ignited Dr. Kevin Burke's new passion for orthopedic growth and development in children. So he saw how this can help their growth and wanted to continue to learn more of why the Munchee was doing this. So in 1980s, Dr. Burke connected oral health with total body health, and he actually wrote a paper on saliva and the importance of it. The Munchee does create a lot of saliva, and we'll talk about that more later on in this presentation. He also was part of the research, and the Munchee is one of the first myofunctional research corporation appliances that was studied, and he was actually part of the foundational work with the MyoBrace. Him and the creator of MyoBrace actually worked on that information together. And then later on in the 1990s, he developed another appliance from the Munchee called the U-Trim that you can use for TMJ problems. And then later on, he retired from practice, and then he did pass. And so let's see, the structure of the Munchee. So the Munchee is made out of medical grade silicone and it's non-toxic material. It's shaped like a mouth guard. So it has a place here for the top teeth to go into the arch and the bottom teeth to go into the arch. And all these little prongs stimulate the gums, and it also has prongs for the roof of the mouth, which helps desensitize the palate. And let's see, some of the sizes, if you can see here, there's like a little prong sticking out there. That also helps the tongue go up to the proper position to the roof of the mouth and gives the tongue something to play with. So there are prefabricated sizes that we'll go over. There is also this handle here that can help with dexterity and give patients something to hold. And also for smaller children, you can use it as a necklace so they can carry the munchie around with them. And let's see the next one. So on oral health, so the munchie, the great thing about it is it can help inflammation. So all of our patients with a lot of plaque, kids having trouble brushing, using the munchie and the chewing mechanism with the little prongs helps remove some of that plaque. The other thing that it does is chewing creates lots of saliva. So with the saliva, Dr. Kevin Burke called it nature's elixir. So when you have dry mouth, you're more prone to getting cavities. When you're not having a lot of saliva, you have more acid production. And when the mouth is more acidic, you're more prone to getting cavities. So with the munchie, it says here, the rate is 30 times the normal rate. Let's see, the ability of the chewing brush to raise the pH of saliva from 5.8 to 7.4 in 30 seconds must have a resounding effect on acid production and plaque and on the oral microbiota in general. So as you can see in dentistry, we love saliva. So when you're using the munchie, having you or your child swallow that saliva, it's really good to help the state of the mouth. So the munchie today it's ran by Mary Burke. She's a chiropractor and CEO and also daughter of Dr. Kevin Burke. So the munchie movement, its purpose is to reclaim natural functioning, chewing, and oral motor function. So there's 5 different munchie sizes. It's used by many different kinds of different people in different fields. So by dentists, myofunctional therapists, chiropractors, speech therapists, and occupational therapists. And there's a short video that I wanted to show of what the lost art of chewing is by the Myo Munchee company. So we'll share that here.
Of chewing. So I'm just going to start with a brief history of chewing. We might be aware that ancestrally we would have spent many hours a day extracting nutrients from our food. And you compare that to what we do now. Most things we either open a packet or a jar and we just put it straight into our mouth. So we've lost a really important component there, and that was the action of chewing. So if we think about what's required for facial growth, we have our tongue. We need good tongue function. We need our tongue to sit on the roof of our mouth. We need a correct swallow pattern. We need nasal breathing for airflow up through the nasal passages. And we need muscular and connective tissue function. And this is where the action of chewing comes in and why it's so important. So what happens when we chew? It's actually quite complex. I don't want you to understand the neurology, but I kind of want you to get a little idea of why it's so important. So the trigeminal nerve feedback circuits from our brain to our face, they inform growth and they activate saliva production and bolus control. So when you're eating, you have your very sharp teeth, you have your soft cheeks and lips and tongue, and your brain's got to coordinate how to make that all work without causing any issues with the sharp teeth. We also have activation of digestion by way of this trigeminal nerve in combination with the vagus nerve and the hypoglossus nerve. And then we have our swallow reflex inflexes with the facial and glossopharyngeal nerves. So there's lots of information coming out of your brain coordinating this whole chewing function and swallowing and digestion. So when we do not practice chewing regularly, we do not develop good coordination of the chewing process, and the muscles can be flaccid, down-regulating this neural input. So it's actually really important that you use your face muscles for chewing and activate the jaw. Otherwise, the brain will not get enough messaging. And actually, over a third of all your brain's information is coming to the lower third of your face. So it's really important. There's really important jobs your lower third of your face has got to do. We've got to breathe, we communicate, we eat and swallow our food. So it's really, really important that this area is well innervated. So what else does...
So as you can see, the munchie and chewing, the mechanism of chewing is really important. Our nervous system is in control of that. There's a lot of information that we obtain through chewing. That video is about 6 minutes long, so you guys can look it up on YouTube to learn a little bit more about the lost art of chewing. So this is the munchie today. There are 5 different sizes. All sizes are recommended depending on age and jaw size. So factors for sizing are jaw size, patient tolerance, low tone, underdeveloped or oral sensory issues. And it's best to start with the smaller size first, and then go on to the next size. So the munchie, form follows function. So what does that mean? So when your muscles of the face and chewing and they're able to function properly, your occlusion is going to work better. So when we have dysfunction in the muscles of the face, the growth changes, and we want to have proper facial development for that growth to occur correctly. So active chewing improves muscular forces on growing bone. The prongs on the munchie improve gum health and function. The chewing mechanism of the munchie increases muscle tone. It decreases rate of bone resorption during aging. It doesn't regrow bone, but it helps keep the bone that you have. And it also helps and assists in prevention of slowing of resorption depending on the person. And the big thing with the munchie is that it helps retrain breathing and makes the tongue go up, and patients learn how to nasal breathe. So malocclusion. So the munchie is helpful to help with malocclusion. So pictured here, these are all pictures of different occlusions. So crowding, protruding teeth, open bite, cross bites, and over bites. And with the tongue, so the tongue actually acts as the framework for the roof of the mouth. During proper swallowing and nasal breathing, your tongue is going up, which makes your palate go wider. When your tongue isn't functioning properly or your swallow isn't functioning properly, you're more likely to have a narrow high arch, which affects the floor of the nose. So retraining the tongue is really important in order to improve the occlusion and swallowing and nasal breathing. So some things that do affect occlusion are also habits. So things like thumb sucking, pacifiers, finger sucking, blankets. We'll go into more details with that. And also diet. So as that video was saying earlier, our modern processed diet really affects occlusion. So having a harder diet like nuts, steak, carrots, hard foods really helps the occlusion form correctly. So here also on the right, there is, this is how we classify primary dentition. So as you can see here, for permanent dentition, it'll show what classification they will be. So our ideal classification is a class 1. So we can see what tendency from baby teeth into permanent teeth, how they will form. This is an ideal occlusion for primary teeth. So we want to have a lot of good spacing in between the teeth, and that allows permanent teeth to have more room to come in. So when we see children coming in with narrow arches already, a lot of crowding, these are patients that can benefit from a munchie and help with some of that oral dysfunction. So the munchie and malocclusion. So the munchie is useful to assist therapy for orthodontic interventions. It helps develop the soft tissues, stimulating muscle action and function within correct occlusal relationships. It assists, lengthens tension relationships, and strengthening skeletal muscles. So the munchie is exercise for the mouth. All of this exercise helps the function of the teeth. And it is a tool for early intervention and prevention. It can replace for non-nutritive sucking habits like pacifiers. And it is a good way to implement early on for ages 2 to 6 with malocclusion, especially if in that age group they're too early to be referred to orthodontic treatment. So the munchie can also be used during traditional orthodontic treatment with patients that have removable palate expanders. They are also good candidates for using the munchie. And you can also use the munchie passively with brackets on. And the passive way is just having the munchie in the mouth and not chewing. So these habits here are non-nutritive suck habits. So these are habits that they're not getting any nutrition, such as thumb sucking, finger sucking, using a pacifier after 6 months. Studies before, we used to say to wait you can't have enough time until age 3, but now we're seeing that we're getting a child off a pacifier as early as 6 months is the best. Other passive suck habits are shirts, blankets, and hair. So with these habits here, sometimes a patient can have a tongue tie or low tongue posture. Our tongue should be up behind the front teeth on the incisive papilla. And when we check patients to check if they can put their tongue up, you'll see us having them open up and can they put their tongue there. Usually if they have a tongue tie, it's really hard for them to do that, or if they have low muscle tone, which can contribute to them also still having one of these habits here. When your tongue goes up to the roof of the mouth, it releases endorphins. And when you use one of these habits, it also mimics that. They get endorphins and comforting feelings. So we really want to retrain the tongue to go up to the proper position where it needs to be. So the munchie and the non-nutritive sucking habits. So with these habits, we have to be careful introducing the munchie and really talking to the patient. So in pediatric dentistry, we call it tell, show, do. So we want to talk to the patient, really encourage them, build their self-esteem about why this munchie is necessary, how it's going to help them, and make it seem like a very positive thing for them and really encourage them. So with these habits, a straight up swap is the most effective. You want to begin using the munchie for up to 5 minutes at a time when the child may not be typically triggered to suck. And the reason we want to do this is we want to create a positive view with the munchie. So using it during reading, using it with parents is positive. If we just automatically just give it to them with the habit, they can see it more like a punishment sometimes. So we want to make the munchie use fun and exciting for them. Once they're comfortable munching, we'll have them use the munchie as an alternative during suck habits whenever they are more likely to do it, whether it's during TV, car rides, story time, or bedtime. And it can take up to 2 to 3 months to change and repattern the sucking habit. So it can be a little challenging. Sometimes we will refer patients to see a myofunctional therapist early on to also help with the habit elimination. So pacifier use. So with the pacifier, we want patients to not use a pacifier longer than 6 months. It can create negative effects. So the duration of pacifier use, the length of use, and the intensity all affect the changes of occlusion and oral dysfunction. So using a pacifier can also reduce breastfeeding duration. It can negatively develop the palate and occlusion. It delays normal progression of biting and chewing and swallowing. It can create soft tissues disorders such as tongue thrust. The tongue goes forward with the pacifier instead of going up and back. So patients end up having a hard time swallowing, controlling saliva. It can also increase the incidence of ear infections. We'll talk about that later as well. And it can also have psychological factors. It can interrupt mother-child bonding, difficulties with facial mimicking, issues with attachments, obesity, and addictive behaviors. So the munchie and pacifier use. The munchie actually can replace the pacifier. Using the munchie doesn't have a negative effect. So if a patient wants to use it frequently, they have the ability to do so. So it promotes correct occlusion, chewing, and swallowing. The prongs provide sensory input and chewing stimulation. It aids in breaking a habit instead of going cold turkey and not having anything to use. So our protocols with using the munchie for babies and children that are nonverbal, we can give them the smallest size, which is the baby size, and that starts at 6 months until about 18 months, but also depending on the jaw size. Verbal children who can say no may need a little bit more encouragement, which is when we do the tell, show, do, and really make the munchie a positive thing. Like really encourage them, like, this is your big boy, big kid pacifier. One family called it their rainbow pacifier, a munchie pacifier. So we want to make it a really big deal that it's something special that not every kid gets to use. We also want to swap the pacifier for the munchie right away. Sleep can be a little disturbed if your child usually uses the pacifier for sleep. We did have one mom who said it took her 2 days of having some restless sleep, and after that, her child didn't even ask for the pacifier, use the munchies. So it is possible. Oops, wrong way. So here is an example of anterior open bite, which happens because of the pacifier. So when you're using the pacifier, that force creates an open bite and protrusion of the teeth. So here we have one of our patients. She was 4 years old, and she used her pacifier all the time. She's actually the one that we had, her mom and her named it the rainbow pacifier. So she transitioned to the munchie easily. Mom said we got rid of the pacifier right when we got home. She wore her munchie on her shirt like a little clip and used her munchie every day, a couple times throughout the day. And these are the results after 3 months of using the munchie. So you can see before her bite was more open, and now her top teeth are trying to go over the bottom teeth. So as she continues using the munchie, it will restructure some of the muscles and the tongue. And this one here is an example from the Myo Munchee company. So this patient here stopped using the pacifier at 3 years old and transitioned to the munchie. He used it during reading time, 5 minutes at first, and then built up to 25 minutes at a time. So this here is only 2 months of progress. You can see how open his bite was. His tongue has low tongue posture. The bite started closing more and more. So our ideal position is to have the front teeth a little overlapped on the bottom, over the bottom teeth, and we want that tongue to learn how to go up. So the munchie can help occlusion. So it helps with anterior open bites, as we saw in the last slide. It's been clinically shown to help open bites for over 50 years. It's easy to use for parents and patients and to understand, and appropriate growth forces to bone by way of active muscle function. So using the munchie actively changes the growth forces and helps the occlusion in a positive way. Anterior open bites and mixed dentition. Munchies can be used in conjunction with the removable growth appliances. So with palate expanders, it stimulates correct muscle function and force. Sometimes with mixed dentition, patients will bite harder. So the munchie can break down a little bit quicker in those cases. So protocols for these kinds of occlusions: you would begin 30 to 60 seconds of active use and increase time to 5 minutes over a 2 to 4 week period. The ultimate goal is achieving 2 to 5 minutes of chewing, depending on the age, 2 to 3 times a day. So even a couple minutes a day throughout the day is helpful than just one long period at a time. So that's what we usually explain to parents when we come in and we show them how to use the munchie. So the munchie can also help with posture. So the stomatognathing system utilizes up to 40% of the motor nervous system output to perform oral and communicative tasks. So that's a huge percentage. Postural compensation. So when you are a mouth breather, as you can see in this picture here, you're more likely to have a forward head posture, and that can compromise your airway. You're more likely to mouth breathe. It can create TMJ, pain and dysfunction, lack of movement, poor ergonomics, digestive dysfunction, mood and emotional disorders, and aging process. So our ideal position is here. We want to have a patient upright, nasal breathing, the palate is wide, good tongue posture up to the roof. When you're mouth breathing, your palate's more narrow and your tongue is low in the mouth. And the munchie can improve the function of the muscles in the joints. And also the cervical spine is descending postural driver on the structure below and improving overall posture. So using the munchie can also help with the posture. So this is a chart here created by Dr. Peter Burke and Dr. Burke about the dynamics of forward head posture. So the first thing is nasal insufficiency. So as you can see, if you can't breathe through your nose, you start mouth breathing, and it's a trickling down effect. And you start having compensations in your body. So really relearning how to nasal breathe and retraining the tongue and nasal breathing, especially at a young age, can really help prevent the health of a child in a good way. So this is why we're doing what we're doing. So with posture, the recommended use is passively first. So with passive use, you're just going to put the munchie in your mouth, lips closed, and this helps with jaw positioning, creating biofeedback and resetting the oral posture. With active use, it improves posture with particular attention to total body posture while chewing. So when you're working on your posture with the munchie, you're going to sit up, have the munchie in your mouth, you must munch while sitting up to benefit from the neurological input. Other adjunct uses are neural stimulus when performing floor and standing exercises, enhances both the form and benefits of exercises that help with posture. So sleep disordered breathing, you might recognize this slide from some of our previous webinars. So this just is a visual of mouth breathing. So when you're mouth breathing, you're inhaling all the air through your mouth. When you nasal breathe, you're able to clean the air, warm the air. And when patients are doing a lot of mouth breathing, they're more prone to being sick, having their adenoids and tonsils enlarged. So it's just a really trickling effect with mouth breathing. So mouth breathing is a result of symptomatic dysfunctions of the upper respiratory system. It can be an airway blockage. It can be because the tongue's not going up, creating a seal. And it can also be structural. Having a long face, it's really hard for patients to breathe in and out of their nose with that kind of facial structure. So the munchie helps breathing by conditioning the orbicularis muscle to maintain lip seal. So strengthening the lip muscle so your lips are closed and knowing how to keep your lips closed. It promotes nasal breathing, afferent input to chewing and swallowing cranial nerves. As we saw in that video earlier, chewing is a neurological concept as well. Your mind is involved in all of that. It assists in coordination and repatterning of breathing, chewing, and swallowing. It can also be used in adjunct breathing retraining and therapy programs. It also addresses structural and myofunctional imbalances that contribute to mouth breathing because of pacifier and thumb sucking. And it retrains and rehabilitates nasal respiration following ENT procedures. So the munchie is very useful in learning how to retrain your nose and tongue and everything for nasal breathing. So the munchie can help. So this is a little more information from our previous slides, but when you're breathing, you want your lips closed, tongue up, teeth together, and breathing in and out of your nose. So the nasal function here, let's see. So this is a classic view of what chronic mouth breathing, how you start to look. You end up having a longer face, open mouth posture, and forward head posture. Here you can see someone that is able to nasal breathe. Facial development looks good. It looks like good growth. Lips are closed. Mouth breathing here, this is all the stuff that mouth breathing contributes to, which we explained a little bit earlier. So protocols with breathing. So when you are using a munchie or recommend using a munchie, we really want to make sure that patients are able to breathe in and out of their nose. So sometimes it can be just habitual and sometimes it can be a nasal blockage. If we feel like maybe there's a nasal blockage, you may need to be able to be evaluated by ENT. Other things that contribute to problems with mouth breathing are allergies. So we may discuss using allergy medicine. One thing we've really been working on with all of our patients here is nasal hygiene. Nasal hygiene is key. So one product we've been recommending is Xlear, and this has xylitol in it. It helps clear out any allergens through the nose. It re-moisturizes the nose. This version here is a kid's version, so the stream isn't as strong, and kids can actually do it on their own. Dr. Melissa, I know she uses it with her girls, and they actually do it on their own. And the good thing about the xylitol is that it tastes sweet, so when it goes into the back of the throat, it actually tastes good. I use the adult version, and this helps me a lot. So with breathing issues and mouth breathing, the protocols with the munchie is consistent munching up to 2 to 3 times a day for 5 minutes. So this will work with that lip seal, tongue going up, and just all the structures of the face. So this is one study here. One explanation is there is a link in human function between nasal breathing and the functions and oscillations of the limbic system. This research is significant, especially in relation to working with children, as those who can restore nasal breathing are enabling not only improved functioning of airway health, but the capacity of children to process and self-regulate their emotional states and well-being. Zilano et al. 2016. So This study here is just talking about how important nasal breathing is for children in processing and self-regulating their emotional states and well-being. So something like the munchie, being able to introduce it early on and helping children in this way is really amazing. So another thing that the Myo Munchee helps with is swallow pattern. So I'm going to show this short video in just a moment, but I do want to show you guys here on this diagram. So this is the tongue. It is a huge muscle or muscles. It's 16 muscles, 8 on each side, and this tongue aids in swallowing. So it helps with producing saliva, creating a bolus, and it does a backwards wave to swallow. So if your tongue is anchored down by a tongue tie, or your tongue isn't strong enough to have a correct swallow pattern, or it has a dysfunctional swallow pattern, you can see how you can run into trouble. So this is a short video about what swallowing looks like, and the munchie helps teach and retrain swallow patterns.
Swallowing, also known as deglutition, is the name for the process by which food goes from mouth to pharynx to esophagus. Swallowing has 3 phases: the oral or buccal phase, the pharyngeal phase, and the esophageal phase. The oral phase is the only voluntary part of swallowing. After food has been chewed and moistened with saliva, the resulting bolus is pushed to the back of the throat, called the pharynx, by the tongue. This involves the tongue rolling back to prevent food from going forward into the mouth. As this happens, the soft palate rises to prevent food from entering the nasal cavity. The pharyngeal phase begins when receptors in the oropharynx are stimulated. This triggers initiation of the swallow reflex, which is involuntary. This part of swallowing must be coordinated perfectly because the pharynx is the entrance to both the esophagus and the trachea. While the esophagus leads to the stomach, the trachea leads to the lungs. The vocal folds are located in the larynx, which is at the top of the trachea. The vocal cords close and the larynx gets pulled up as the epiglottis flips over the entrance to the trachea. The upper esophageal sphincter opens to allow the bolus to enter the esophagus. During the esophageal phase, food is propelled down the esophagus towards the stomach by waves of muscular contractions known as peristalsis. The larynx moves back down and the epiglottis flips back up so respiration can resume.
Okay, so I love that video. I'm a visual learner, so I always appreciate the videos. So as you can see, swallowing, the mechanism of swallowing, you don't even think about it, but the tongue plays an important role. So using the munchie can help retrain and with the dysfunctional swallowing. Let's go to the next one. There you go. So yes, the munchie can help with salivary control. So drooling after 2 is not normal. So some reasons for drooling after that age are tongue thrusts, malocclusion, reverse suck swallow patterns from oral habits such as pacifiers, and ankyloglossia, which is tongue tie. Here's a short video of a baby with a reverse swallow due to a tongue tie. So you can see that the baby is pushing the tongue forward. So this is going to interrupt development of the jaw muscles and face and swallowing food, choking, things like that. So implementing munchie earlier on can also be helpful in those cases. So the munchie helps with the correct swallow, tongue goes up. The size of the munchie inhibits improper function of the lip and facial muscles. The lips close around the munchie helps inhibit suck swallow and promotes the correct swallow pattern. It strengthens the orbicularis oris, which are the lip muscles, and helps create a lip seal and saliva management. So in cases with swallow pattern dysfunction, you want to begin slowly using the munchie. A lot of the saliva will pool up in the mouth and can cause some gagging. So sometimes this can be really hard for patients to tolerate, so you want to start slow. So suggested use is passively for 30 to 60 seconds. And then once the patient is able to do that without gagging, they can start munching for small periods of time to build up tolerance. One thing I also learned with the munchie is that you can do something to distract yourself so you're not gagging. So like humming or humming a song, that will help distract the mind from wanting to gag. So starting off small and slow progressions are ideal for children in young ages. Okay, so ankyloglossia, so tongue ties. So if you've been to our office, we check all of our patients for possible tongue ties and symptoms at every recall. Even if we see you every 6 months, we just check, make sure there's no symptoms of tongue ties. So here in this picture, you can see this is a restricted tongue tie. So when you have a tongue tie, it can cause a lot of symptoms, and some of those are, let's see. So well, let me gear back. So tongue ties assist tongue and saliva control via training muscles and mastication. So the munchie can help in tongue tie situations because it will help you retrain the muscles of chewing and swallowing. It improves chewing and swallowing function with the mouth closed. The munchie can also be used before and after frenectomies, which are tongue tie releases. Munching stimulates and integrates the cranial nerve. So we heard that a little bit earlier. So if a patient has a tongue tie and is using the munchie for that, you want to start using it for 60 seconds passively and then move on to active use. So work on 1 minute of active munchie and then 2 5 minute munchie sessions. So you can do 5 minutes in the morning, 5 minutes at night. And then sometimes it can be challenging due to the gagging. And then myofunctional therapy may be recommended as well to do more oral exercises to help with the tongue dysfunction. So the munchie can help during speech as well. So it can be used in some speech therapy, patients in speech therapy. It can help with tongue thrusts, which creates lisp, sound production, dribbling and drooling, helping with proper swallow and chew, help with tongue tie restrictions. It strengthens the lips, tongue, and muscles of the face. So a lot of myofunctional therapists who you also use the munchie in their practice as well. So the munchie can also help with TMD and TMJ disorders. So when you have the munchie, it actually puts the occlusion into class 1 and helps align the relationship of the condyle process of the mandible and mandibular fossa of the temporal bone. The munchie can be used by dentists for treating acute TMD as a short-term solution. So another way the munchie is helpful is with otitis media, which is middle ear infections. So it's the second most common disease of childhood. It's usually treated with antibiotics. Chewing and swallowing dysfunction are more likely to be prone to ear infections. So when you're doing some chewing, the chewing mechanism, it helps clear out the fluid from the ear. So if you have an improper chewing or swallow pattern, that fluid isn't getting cleared out. So this is sometimes when we see a lot of patients that have ear tubes placed early on, frequent ear infections, had to have a lot of antibiotics. So these are signs that could possibly mean that there is something going on with the tongue, oral posture, or chewing or swallowing dysfunction. Having a class 2 overbite also impacts the ear drainage as well. So using the munchie, that chewing mechanism helps prevent and shorten treatment of ear infection. And it also creates a vacuum on pediatric eustachian tubes to help with that whole fluid drainage. So the protocol with the munchie for otitis media is active use, 5 minutes of active use 2 to 3 times a day. And then there's also some myofunctional therapy exercises that can go along with it. So other reasons the munchie can help, bruxism, so grinding. It can help align occlusion to class 1, disrupt grinding pattern. It's not to be used during sleep. Patients that have pacifiers and thumb habits, they can use it to fall asleep, but you want to take it out once they're asleep. And also breathing exercises. So teaching patients how to deep belly breathe at an early age can also help with grinding. And we have seen results here at Shaylin's, recommending it for grinding. We've had patients not grind as much or stop grinding once they started using the munchie. The munchie also can help with sleep disordered breathing. It tones the muscles of the tongue and mouth, which improves the oral posture. So munching up to 3 times a day for 5 to 10 minutes for the first eight weeks, and then 2 times a day for 5 minutes. It can also help with snoring by improving the oral posture. Also for patients that are autistic, have sensory processing disorder, or other special needs, The Munchee is a great tool to help with sensory stimulus. A lot of patients with these special needs like to chew on objects, and the Munchee is a great way to help with that, and also helps with oral health. The chewing helps with oral motor function, neuromuscular control, coordination of chewing muscles, aids in swallowing mechanisms, and helps with the calming effect of sensory afferent nerve pathways. So with patients that are special needs, it's best to start slow, a smaller size, and it takes about a minimum of 6 months to see results. So these are all the Munchies here. There's 5 sizes, and we're going to go over them here. So the first size is the baby size. It can be used starting at 6 months all the way to 18 months, and also depending on the jaw size. So this size is actually only available through a practitioner. So you can't buy this one online by yourself. You have to get it through a practitioner. This is a diagram here from the Myo Munchee website, and these are just milestones of oral development for this age group here. So some symptoms of needing a Munchee early on is drooling, frequent ear infections, enlarged adenoids and tonsils, sleep disturbances, pacifier, and thumb habit. So these are some milestones that you want to see as the child grows. So 0 to 6 weeks, the neonatal primitive reflexes. And so you can see that. So we want to stop having patients use the pacifier after 6 months. So you can see that there, all of the development. So the mini size, it can be used from 2 to 4 years old. These are some more milestones with development. So this is actually one of our hygienists, Sally's daughter here on the left, Mia. She's using a Munchee. And then, so the Munchee, 60% of facial growth will occur in the first 4 years of life. Make sure it's optimal. So this is why introducing a Munchee early on, and if we see any signs of dysfunction, we really want to get patients and parents on board with using a Munchee. So by 2 years old, jaws, lips, cheeks, and tongues are working independently of one another. Around, there's also 16 teeth erupting around that age. And then you want to have a balanced bite so patients can chew. And if there's dysfunction there, they can have problems with chewing, eating, all of those things there. So signs of dysfunction, these are some of the signs. Some of them are repetitive as before. So drooling, pacifier use, nightmares, delayed speech, ear infection, grinding, everything there. So this is the junior size. It can be used from age 4 to 8. So with the junior size, for this age group, it can help with jaw strength and stability. Children for this age can perform daily Munchee activities for 2 to 3 times a day for up to 5 to 10 minutes. For patients of this age, we do want them to be conscious of what they're doing and chewing. So they can chew or munch for a song or reading with their parents or an activity that lasts 5 minutes or longer, but we do want them to be conscious of munching, having their lips closed, and nasal breathing. Because sometimes if they're, watching a TV show while they're doing it, they might not have the correct mechanism for chewing. So the tween size is 8 to 12 years old. This can also be used for adults that have narrow arches. So sometimes the adult side can still be too big for patients that have narrow arches. So some of the same signs of dysfunction there, yeah. And then here's the adult size, so 12 years old to adults. So for adults, some signs of dysfunction, allergies, sleep disturbances, anxiety, crooked teeth, misaligned teeth. So adults can also use the Munchee. This will help develop the facial muscles. I use a Munchee. I've been trying to work on using it every night, and Dr. Lopez does too as well. And I have trouble mouth breathing at night. So I like to use my Munchee before bed so my lips can get stronger and my tongue can make sure it's going up when I'm breathing at night. So we have now the Myo Munchee program at Shadelands, and we are certified. Dr. Melissa is certified. So this is our completion of the Myo Munchee certification here. So we did take the classes and learn more about the Munchee. And I want to talk now about our Myo Munchee program here. So our why. Why are we introducing this program? It points back to the same why at the beginning, to identify potential issues early enough so our patients can keep growing healthy smiles and minds for healthy breathing and sleep into adulthood. So we talked about having good, correct oral posture, learning how to nasal breathe. This all has effects as children grow into adults, and we want them to have the best healthy selves that they can be. So the reason why we also introduced this at Shalen's is it's an easier tool to implement early on. It can help patients and family who may not be ready to start myofunctional therapy just yet due to age, finances, time. It's easier for families to commit to using the Munchee versus myofunctional therapy. It can help with the function of the muscles of the mouth, correct tongue placement, development of nasal breathing, develop proper swallowing, helps with guided growth as form follows function, helps with habit elimination, encourages saliva control, helps stop bruxism and grinding, and helps correct malocclusion. So the Munchee does not take place of myofunctional therapy or orthodontics in the future. So these are some of the Munchies here, a little video. So the first one's the baby, the mini, and the junior. You can see they have the arches for the top teeth, the bottom teeth, all the prongs. The mini Munchee doesn't have the little part for the tongue to play with, but the other sizes do. So these are the Munchies, a 3D real life version of them. So the Munchee, the first way to learn how to use it is passively. So I do want to play this video, but passively is just having the Munchee in your mouth, lips closed, learning how to breathe in and out of your nose. And before you turn to go to the active use, we do want patients to be able to use it passively for 1 minute. So here's a quick video by the makers of Myo Munchee.
Sometimes it's good to start with what we call passive use. Passive use means that the Munchee is sitting in the mouth and the lips are just resting around the appliance, and you're just finding the point at which your jaws can rest comfortably. And sometimes that won't mean the lips are together, but that is still beneficial because we can get release into the soft tissues of the throat and the jaws, and also you can practice your swallowing in that position. Sometimes if we've got old patterning where we've been using the incorrect muscles, it can be quite good exercise just holding the Munchee in the right position with the jaws and letting the muscles work differently. So that's what passive use looks like, and it's very beneficial. And then you're practicing the nose breathing, and your brain is learning a new posture. And that's an important part of it too, because the brain patterning will be there with these old patterns. We're trying to learn a new pattern, and just resting into that passive posture for periods of 5, 10, 20 minutes can be really powerful.
Yeah, she said using the Munchee, it's retraining your muscles. So even just sitting with the Munchee, especially patients that are chronic mouth breathers, this is really going to be the way to really help with that and restructure and retrain everything.
Okay, Gigi, can you show
So
me?
this is Gianna, Dr. Lopez's daughter. So she's going to demo for us how to use it passively. And she's 4 years old with the mini size. So before you use the Munchee, you do want to rinse it with water. The side with the indentation goes up. So you want to make sure that patients are using it that way. Practice breathing in and out of your nose. Sometimes this can be challenging if patients have a tongue thrust or problems with controlling saliva. And you want to keep it in the mouth for 1 minute with the lips closed, breathing in and out of the nose. So she's going to demo that for us.
Your Munchee? Okay, so you can see that she has the indentation side. This is up, and she's going to place it in her mouth. Okay, can you place it in your mouth, Gigi? Yeah, and put it in your mouth. Yeah, good job. Okay, can you close your lips on it and breathe in and out of your nose? Good job. And this is the passive way to use it. So her lips are fully closed and she's breathing in and out of her nose, and this teaches her to nasal breathe.
Okay, so as you can see, her lips are all the way closed and she's able to breathe in and out of her nose. So she did a great job demoing that for us.
Okay,
And
this is
here
Anais.
is Anais. She's also going to demonstrate the passive use. She's 6 years old and she's using the junior Munchee. So same thing, make sure the indentation side goes up.
She's gonna demo the Munchee. She's a 6-year-old and she has the size junior. So she has the third size. So she's gonna place it in her mouth.
And you have to see where's the toy.
Oh yeah, look, so this is the little part that goes on the tongue and her tongue gets to play with it. And I want you to flip it this way. There's that little indentation. Make sure it's going up in the mouth. All right, perfect. And lips closed. And I want you to just breathe in and out of your nose first before chewing. Then go. Take another deep breath through your nose. Good job.
Yeah, so I love how she pointed out the little toy to play with her tongue. So that's a good way to encourage kids, make it fun for them. And you can see her lips are closed and breathing in and out of her nose.
A little close, more close.
Now she's
There you
actively
go.
using it.
And chew, chew, chew. Good job. And breathe in and out of your nose. Awesome. Perfect. All right.
All right, so you can see that she's actively chewing it in that video, and she's biting with her or doing small munching on the video, and then lips are closed. So we usually recommend using it slow at first, like a minute in the morning, a minute at night, and then building up to 5 to 10 minute sessions in a day. A good time is in the car, especially during reading time. We really encourage it to be a bonding time with parents to have the best effect, and just seeing it as a really positive moment and making sure that your child swallows that saliva. It's really good for your body, really good for the teeth. And later on, we can cut the handle off so that patients can really learn how to put their lips closed on there and do the munching. So at the program here at Shadelands for our Myo Munchee program, your child will be evaluated at the first exam or recall appointment by one of our pediatric dentists. If a Myo Munchee, it would be a good benefit for your child. Or we can also set up a Myo Munchee consultation appointment if you recognize any of the signs and symptoms presented here. So during that consultation and delivery appointment of the munchie, we'll take some pictures. We want a baseline. So front face picture, one with their lips closed, a side profile, and one of the bite. And we also will measure the occlusion as well. We go to the next slide. So we'll also measure the occlusion, and we will create a plan, see what we can do as far as how often to use it, times to recommend it. If a patient has any habits, we really want patients to know that we have like a prize for them if they stop using the habit. Sometimes we'll have them pick a prize earlier on so they can have some kind of incentive in order to stop the habit, and we'll have parents take a picture of the child with the present that they get when they do stop the habit. And we will also show how to demo how to use the munchie and give some instructions as well, and a chart to keep tracking of the munchie, just to really encourage the child to keep using the munchie. So after that, we will have a 1 month phone call or FaceTime call with parents. If we have a little trouble with compliance, sometimes we'll do a FaceTime call with the patient to just really encourage using the munchie. And then after that, you will come in for a 3-month follow-up. We'll take new pictures, remeasure the occlusion, see what kind of grade you give yourself for how much you're using the munchie, any ways that we can help. And then after that, we will assess to see how long you should use the munchie. Sometimes we can have you come back for another 3-month evaluation, or we will just keep track at the recall when you come in for the cleanings. Oh, and I love this picture. These are the girls here. Oh. Okay, so how to clean your munchie. So daily, you want to rinse it under water. You don't need toothpaste to clean it. Just rinse it, shake it off, dampen it with a tissue or towel, and let it air dry like a toothbrush. So you don't want to put it in a sealed container. We don't want it getting moldy. If you want to like sterilize it once a week, you can add a little bit of baking soda to it, or place it in boiling water for 1 time a week for 1 minute. And then the munchie should last about 6 to 12 months with regular use. It can break down a little quicker if patients, their occlusion or having really hard chewing mechanisms. And then Myo Munchee will replace the munchie 1 time if it breaks quickly. So that's a good thing. And let's see, so this is the end. So thank you for watching. So my name's Denise. I'm one of the hygienists here. I'm running the program. So you'll be seeing me, hearing me talk about the munchie. And Dr. Lopez, this is us here learning about the Myo Munchee, this picture here. So thank you guys for joining. And if you have any questions, feel free to call the office or email us as well. So
Thank you, Denise. Good job. It didn't show, but she was really, really worried about recording this. She does it every single day, talks to patients about this every single day. And that really shows, it shows up. I did want to address just, we have had some patients and parents ask about research, and it's interesting because the field of airway dentistry has been around for a very long time. However, only in the past 7 to 10 years has the research come out in the pediatric world. And it really wasn't until 2020 when I realized that it did have a place in our daily practice, and we started bringing it into the office. So after 3 years, our office has been growing. And for those of you who have been coming since we opened over 10 years, or about 10 years ago now, you'll have noticed that our attention to evaluating airway as it relates to breathing, to sleeping, to speech, to eating, and to oral hygiene has definitely ramped up. We're really happy to have this Myo Munchee be part of the program. And when parents ask for research on the Myo Munchee, there is the research of the developers, but it goes further. It goes further into the research on sleep disordered breathing, further into the research on adenoids and tonsil hypertrophy, on nasal blockages, on speech, on the list goes on and on and on and on. So we do have a few other videos on our YouTube channel and available through our website. If you want to take a look at those, feel free to give us a call, ask us questions. If you're a patient of ours, feel free to ask us at your appointments. If you're not a patient of ours, consider giving us a call, ask for consultation for airway. Denise and I and Dr. Lee, Dr. Lena, Selly, our other pediatric hygienist, we're all working together to make sure that we give the most comprehensive care for all our patients. Thank you for joining us today. I hope you guys have a wonderful day, and keep breathing.